Warning: this video includes a reenactment of an accident scene for training, including graphic injuries and wounds. Viewer discretion is advised. When someone in northern Alberta calls 911 for assistance, Northern Dispatch is there to answer 24 hours a day. Northern Dispatch answers around 40,000 calls every year from Albertans in rural and remote areas of the province. This morning, a caller has reported that a car has collided with a cyclist. The dispatch operator calmly records all of the information and advises the caller on what he should do. Sometimes dispatch may instruct the caller to perform CPR or other first aid. An emergency medical services team is dispatched to the accident scene with all the details. The dispatch operator is able to request ambulance service, a helicopter, or other support vehicles when needed. The EMS team observes the situation and jumps into action, providing first aid to the injured man. EMTs, EMRs, and paramedics are unique first responders in northern Alberta, gathering a wide array of experience over a large physical area. Alberta's North Zone comprises 70% of the province's land area and includes towns and cities like Slave Lake, High Level, Grand Prairie, and Edson. Often dispatched to remote locations, Northern EMS respond to a diversity of calls not experienced in larger centers. EMS staff work in teams and are trained to act in many situations. EMS personnel provide vital out-of-hospital emergency care. There are 3 levels of EMS practitioners providing services in Alberta. Emergency medical technicians require 10 months training. Emergency medical responders require 52 hours of classroom training. Paramedics require 2 years of training from an approved institute. There are 204 EMS stations across Alberta dispatching AHS and contracted ambulances. They are strategically spread out so that no matter where you live, help is close to hand. After providing first aid, the EMS team stabilizes the patient for a trip to the local hospital. They radio ahead to let the doctors know what to expect. AHS provides EMS services in the majority of Alberta communities, but also contracts with other EMS providers to provide service to all communities in the province. At the hospital, the EMS team reassures the patient and transfers them directly to the emergency room. The team confers with the physician to determine the best course of treatment. After stabilizing the patient and assessing his injuries, the physician decides that the patient must be transferred to a trauma center by air ambulance. The team secures the patient for a quick trip to the airport. AHS owns and operates 278 ambulances in communities throughout the province. In Alberta, there are 12 contracted fixed-wing air ambulances in operation around the province. In the past 12 months, the air ambulances were used to transfer 8,500 patients. That's 23 patients every day. A career with Northern EMS offers a variety of experiences with a skilled team, making a difference in the lives of Albertans every day. Visit the AHS career website to find out more about EMS professions. www.albertahealthservices.ca/careers.